Good afternoon, everyone. My name is Michael Clegg, and I'm the Dean of the Johns Hopkins Bloomberg School of Public Health and a past president of the World Health Summit, co-president. And it's my happy duty to welcome you to this session on education and leadership for health. My co-chair is Fred Bink, who's professor and director of the Institute for Social and Preventive Medicine at University Hospital at Lausanne and the Roman School of Public Health in Switzerland. Our first speaker was supposed to be Roger Glass, who directs the Fogarty International Center at the NIH in the U.S., but for those of you who have been following the politics in the U.S., you know that because of a philosophical difference, the government was shut down for 14 days, 12 days, and so the NIH was shut down, only essential employees. That was lifted, but unfortunately Roger has so much pent-up work to do that he was not able to join us. So I guess his talk was entitled Lessons Learned from 25 Years Supporting Research and Training in Global Health. I guess he would say the lesson is it's a bad thing to shut down research in global health. So please welcome my co-chair, Fred Bink. Fred?
Thank you very much. It's an honor and a pleasure to chair or to co-chair this session with my colleague Michael Clegg, and I'm very glad to introduce my friend Antoine Flahault. Antoine Flahault, he's professor of public health in Paris. He's a medical doctor by training. For several years, he was deeply involved in let's say, modeling of communicable diseases, and then he became dean of the French School of Public Health until the beginning of this year. He will speak about one of the very fascinating development of education in public health, which are the MOOCs. Antoine.
Thank you, Fred, for this kind introduction. Dear Chairman, dear colleagues, ladies and gentlemen, I'm very pleased and happy to have the floor to discuss about these MOOCs, so-called MOOCs, and particularly a tentative we are giving to promote and to launch MOOCs in public health and global health in Europe. Probably many of you are aware of this MOOC mania, MOOC hysteria, MOOC tsunami. It has been said that maybe these new technologies in university may deeply transform and maybe threaten the university and our universities. So we will try to explore what is exactly a MOOC. First of all, we have to realize that today the world of MOOCs, which is really the America of MOOCs, because the four major platforms in MOOCs today are located in the United States. Two of them are more or less, we can say, in the for-profit world. All of them had benefited from huge investments because to allow this massive access to education needs tremendous resources, particularly in IT. But two of them, Coursera and Udacity, are the two leading platforms which are for profit. They were launched from Stanford universities initially, but they have created their own startup. And two of them are joint venture or public settings which are non-for-profit companies who have launched these two platforms. And you can see this image is may show the fact that many stakeholders, not only the universities, but them, many stakeholders, the Bill and Gates Foundation, but also some investors, private investors, have realized or maybe are betting that that could be something very important not to miss and are engaged, really committed in supporting or helping these platforms to be launched in America. The point is, should we go into this process in Europe too? First of all, I would like to maybe define what is a MOOC. What does this acronym mean? It means Massive Open Online Course. Massive means that you are not in the same scale as the existing distance learning programs, which may allow for tens, maybe hundreds of people to attend to a distance learning course. Here you have sometimes hundreds of thousands students who may attend your course at the same time. Coursera, the platform I talked earlier on, today say that they have more than 5 million Courserians, people who have subscribed to 461 courses from 91 partners. 91, most of them are American universities, but there are some European universities also. The second word, open, has several meanings. We can think that it is open, of course, 24 hours a day, because if you are in one part of the world, you may have a need and access at any time, which is not the Los Angeles time or the Silicon Valley time. Open means also, of course, in the field of knowledge, and particularly of academic knowledge, open mind means that you need to have some way to find doubts, to find criticism, to find an open mind view of the new knowledge. Open means it's not locked. You can have access sometimes to open data, sometimes to open source also. Coursera is not open source, but edX, for instance, this initiative which has been launched as a joint venture from the MIT and Harvard University has delivered an open source, open edX software, which is quite useful, not to start from scratch if you want to promote or to found a new MOOC platform on your site. So open has several meanings. Online, we all of us understand what means online, but when you have massive attendance to your course, online has a very important meaning, because you may create a social community around your course, which is something, of course, we have in the existing universities. There are some social networks around the courses, at the cafeteria, or working for the homework, for instance, together. But with the MOOC, we have a new opportunity to create a social community which will work together, which may work together if they are allowed to technically, and also by the course themselves. And the course are something which is in fact very different from the course we have usually in classic rooms, because you cannot have, for instance, 1 hour videos of a lecture. It's boring, it's very heavy technically, so you need to have a new pedagogy which will completely change also the way of acquiring knowledge. Some various things we may heard about MOOCs which are not true. For instance, MOOCs are not on demand. Sometimes we understand that if it is online, that means when I want it, I will get it, and that could be an advantage. In fact, MOOC try to create the same tension you meet in the university when you don't have your course today. If you want a course today on any global health issue, you will not have a course on obesity at La Charité probably today or beginning today or tomorrow. You need to wait for maybe next September, or maybe if you are lucky, you will have a course starting next January. It's the same pace you will find in most MOOC platforms. Why? It is mainly because if you want to create this social community, you need to have all people in the same schedule in really in simultaneous way. That does not mean that you need to attend the lectures at a specific hour. You may have a flexibility, but the course is scheduled, and sometimes when it is finished, it is finished. You have to wait for a new session. Some people say, oh, it's so sad to imagine that the university of tomorrow will be behind screens. What we love in universities is these social networks we have created, but which is a physical network. And many people have met their good friends, sometimes their spouse in the university. So the university has a value and has also a mission which is, of course, beyond acquisition of knowledge or competencies. But MOOCs does not mean that you are alone behind your screen only. For instance, I remember in one course I have followed myself as a student, a map pop up of the world saying that I was living in Paris, and in Paris there was a certain number of people who attended the same course at the same time. And they told me, why not? You can meet together at 9 o'clock in a cafe in Paris, and you can have a small presential meeting where you may work on the homework we are asking you to deliver for next week. So it was possible, it is possible with the MOOC to reconstitute some virtual groups, and we may work by small groups virtually, because we don't want to meet or because we are too far for each other for any residential meeting, but presential meeting, but it is possible. Another thing is that we may imagine that in some universities, they may organize, why not, some classrooms with potential for following the MOOCs, because the MOOCs are demanding regarding the bandwidth, and it may happen in some location, particularly in sub-Saharan Africa, where the internet connection are not yet sufficient enough in most parts of the country. You may find some location where you may organize the attendance to the MOOC, and so MOOCs may also be a way of triggering some social activities and not only to stay alone behind your screen. About the assessment or process, or we may find some criticism regarding MOOCs saying that they are only very superficial because relying on quiz. That's true. There are some quiz, but the quiz usually are not for assessing really the students. It's more for self-assessment, to be sure that you have understood the previous sequence. The previous sequence may be a 5 or 10 minutes video, and we are never sure that behind the screen the public is so heterogeneous, backgrounds are very different. Maybe we may have to guide the students, not they are adults, they may really skip them, but maybe they have some guidance saying you seem not to have completely understood this sequence. We advise you to come maybe on more literature on that, or maybe on complementary material and so on. But the main purpose of the assessment could be completely different. We may have, of course, if we have 50,000 people attending to your course, you will not be, as a teacher, a professor, you will not be able to assess all the essays, for instance, and to mark them, to grade them, but you may organize some peer assessment. The MIT recently launched a digital assessment, automated assessment of essays, but it is very criticized, and we probably not, we cannot rely on that, but that could be, why not, tools for self-assessment again. But we can believe that the peer assessment, providing there are some training of the peers to assess, which is not so trivial, but we may imagine that the peer assessment can be something very interesting, and why not, in some way, not so far from what we could expect from an assessment of an essay from a faculty. Of course, behind MOOC, there is faculty, which is huge work. To deliver a MOOC course is really demanding for the faculty point of view. the universities, because of course the MOOCs, the lectures and the courses are funded and based on research behind that. So we need some research teams, some research labs, we cannot separate the teaching from the research. And also they are not only the professors, there are technicians, there are engineering behind all that. And pedagogical engineering. We are not constructing a course exactly as if that was a course delivered in a classroom. And there is a lot of computer science, and probably very few actors can today build and develop MOOC platforms. In the private sector there are some. There is these huge actors from the Silicon Valley or from the MIT, as we said. In France, we have INRIA, which is the National Institute for Research in Computer, which is a brilliant institution for computer research. And we need these bodies. École Polytechnique Fédérale de Lausanne also is this kind of agencies or research labs or bodies are very, very important to commit if we want to develop platforms which will be tomorrow completely different as they are today. So we need to embed that within research. One point I want to underline is regarding the economic model. The economic model of MOOCs is not so clear. Sometimes it is said it's not stabilized, but it's maybe a way to hide the fact that in the US model, which the academic US model is completely different as the European academic model. In the American model, of course, courses seem to be free from the student's point of view. Of course, they are not free from the university point of view. They have to deliver these courses. But the platform is for profit, as I told you. And what is clear is that the value of these MOOCs are the big data which are behind the MOOCs. The students' data, not only the marking, but the behavior of the students, the fact that they are good participants in the forums and in the tweets, and so they are leaders, they are expressing their skills, not only by taking their exams, but also by all their behaviors. And these behaviors are sold to hiring company or to a company which may be very interested before hiring to have this profile. We will not do that in Europe by law and also by culture. Our university is really embedded in the public service, and we are also very, very focused on protecting students' data, and students' data will remain students' property. So that will be funded by the public and the private sectors as sponsors, or as maybe we may find some other economic models relying on small fees. Why not on premiums, on this kind of models? But that should be first transparent and second very clear regarding the students' data. One word regarding the Center Virchow and Vierme. It rely on the values of the Traité de l'Élysée, Élysée-Vertrag. This Élysée Treaty was built for building the Europe and building the reunification of all the people in Europe after the Second War. And 50 years after the treaty, 1963, our government decided to promote public health and to promote research and MOOCs in public health. So that will be our mission at Charité and at Sorbonne in Paris, not to only focus on our two institutions, but to open the box for all the European countries. So thank you for your attention. You will see these MOOCs on our platforms, which are for the moment in French, because we absolutely need to have material in French or material in German, which are lacking today on these platforms, but they will be translated in English and translated in German. And by crowdsourcing, we hope to translate them in many languages. Thank you for your attention.
Many thanks, Antoine, for this very complete presentation of this MOOC. I suspect that, until the 19th century, educating the children was really a face-to-face meeting, and the classroom was a major invention in the 19th century, probably a condition just to deliver education to the world population. And perhaps with the MOOC, we have some sort of similar evolution, similar move in education, in the economics of education. Now it's my pleasure to go. We will have a large, ample time for discussion just after. We'll now go to the second speaker. It's my pleasure to introduce Ole Petter Ottersen. Ole Petter is a medical doctor by training. His research field was or is neuroscience, but however, he developed a whole career as a rector from the University of Oslo. I'm sorry, the president of the University of Oslo in Norway. And he will speak about a theme which is, I think, extraordinarily interesting, which was one of the development in his university, but also as a part of a concerted effort with Lancet, the global governance for health.
Thank you. It's a real pleasure to be here. And my point of departure will be education, so I'm happy to see that there are many medical students here as well. The setting for this particular presentation will be, indeed, education and leadership for health. And in fact, one of the motivations I had for taking on the responsibility of becoming the president of the University of Oslo was to see if we could develop the education within medicine and global health into something that takes into account the complexity and also the political aspects of this particular issue. So I will take you back 3 days in time. 3 days ago, I handed out a prize for diabetes research on diabetes 2, to a distinguished scientist. There were many medical students around, and they asked a very important, I think, question. The discovery that was awarded on this particular occasion was made in the 1990s, early in the 1990s. And what does this figure tell you? Well, despite the advances made in the understanding of this particular disease, the prevalence of this disease has increased immensely, as you see, over the last 20 years. This is very well known to all of you. But the students became interested, and they asked me, how come that you have this discrepancy between increased knowledge about the mechanisms of disease and the prevalence of disease? And of course, there is one easy response to this. One thing is, of course, the individual's responsibility for lifestyle, but there is no doubt that there are political determinants of health involved here. Marketing of unhealthy food, taxation policies, and so forth. So already at this stage, one sees very clearly that there is something beyond the biomedical explanation of health. One has to look into the political determinants, and I think the students were very willing to accept that. So the University of Oslo is a research university with 8 faculties, and one of the major goals, I would say, of the university is exactly this, to educate future leaders for health. Not only leaders that go into the health sector, but also leaders that go into the other political arenas, keeping with them the understanding that health is of paramount importance in all policy arenas. So one of the important issues, of course, is that research and education must take into account the multidisciplinary, cross-sectoral, and political nature of the challenges at hand. And I'm very happy that a few years ago, as you all know, there was this ministerial declaration, the Oslo Ministerial Declaration, that I think very much to the point stated that health should be a key outcome of foreign policy. And I think we are still living in this particular realm that health should be of importance when it comes to this issue. So when educating future leaders for health, there are two important things to consider in my mind. We need to consider the many actors and forces outside the global health system that impact health, directly or indirectly. And even more importantly, there is a need to identify the global governance gaps that propagate health inequities, the unfair and avoidable differences in health status seen within and between countries. And when I took on the task of becoming a rector, I asked a very simple question. Are our universities, or more specifically my own university, equipped for this very complicated task? And I would say, well, not necessarily. So this is the point of departure for the rest of the presentation. While we were struggling with these issues, very important issues when it comes to education, a fantastic opportunity came up. Richard Horton and Julia Frank of Harvard came up with the idea of making a commission on global governance for health, addressing, in fact, in particular, the global governance mechanisms outside of the health sector, to look at the dysfunctions and gaps that are to be found there. And I was asked to become a chair of this commission, and I accepted with pleasure, because this gave me and the university a sort of possibility to look into these very complex issues, to see if we could improve education and research based on the conclusions drawn by the commission. So I will tell you a bit about the commission, the point of departure, the aims, the political relevance, key messages, and so forth, and also finally ending up where I started. What are the implications for educational leadership based on the conclusions that we made during the work in this commission? So the commission is all about, you could say, the effect of globalization, which has tightened the links, as is stated here, of interdependence, but which also opens new possibilities to look into the root causes of disease and ill health. And when we met the first time, I think we all agreed in the Commission that we are motivated by this shared conviction that the current system of global governance fails to protect public health adequately. And of course, as you all would know, these failures, they strike unevenly. And not very surprisingly, our analysis clearly shows that the failures strike particularly the world's most vulnerable, marginalized, and poorest populations. The point of departure of this particular commission is the report of the Commission on Social Determinants of Health from 2008. And I'm very glad that Sir Michael Marmot is here in the audience, and he was a very important member of the commission as well. So what we try to do is to look behind, so to speak, the social determinants of health, to see what are the root causes in the political sphere. And there are two very strong arguments that we put forward in this commission. One is that the deep causes of health inequity cannot be diagnosed and remedied with technical solutions or by the health sector alone, because the causes of health inequity are tied to distributive justice rather than to biological variance. This is one strong statement, I think. And the other one is that construing social and politically created health inequities as problems merely of technocratic or medical management depoliticizes social and political ills. So this is really some of the key issues that we were looking into during the work done by this commission. And one important aspect to be remembered here is, as I said already, that we are looking at, or we did look at, global governance processes outside of the health arena to see how these arenas can be improved so as to secure a continued success of the global health actors. The Commission consisted of 18 members from 16 different countries with many different fields of expertise: trade, environment, human rights, war, conflict, and so forth. Also political economy, of course. And the members are shown here. I already mentioned Sir Michael Marmot, but there were members from all over the world, basically. The research team, coupled to the Commission, had a base in Oslo, in my own university, as well as at Harvard. And very importantly, in terms of education, what we did, and I think this was a very important thing to do, was to establish a parallel commission, a youth commission on global governance for health, that followed the main commission closely and came up with rather harsh criticism on many occasions, deservedly so, I think. So these are the future leaders, and they were following our work very, very closely. We had 5 meetings in different parts of the world, and one example as to how these meetings played out was that we looked for these global governance gaps when we had these meetings, for instance, here in India. And one of the gaps that became very clear and concrete to us during our India visit was the Bhopal gas leak disaster, which is still with us, in fact, 29 years after the fact. This came as a surprise to me, but still there are tens of thousands of people that suffer even today because of this disaster 29 years ago. For instance, the groundwater is contaminated still. So this shows one very important political determinant of health or ill health, and that is that there are these failures on the part of global governance system to really cope with the risks involved in transnational companies. When it comes to the conclusions after the meeting in India, it was quite clear that transnational companies, they do operate everywhere, but very often they are above the law of the countries that they operate in. And as is stated here, there is no forum where the transnational corporations can be held accountable for their crimes. So this illustrates just one of the gaps, I would say, in global governance that severely impacts health even today. So during the work of the Commission, we did a lot of case studies, particularly within these 6 areas or arenas that you see here: global finance, global trade, agriculture, intellectual property rights, migration, violent conflict. And one of the most important things that came out of this work, I think, was the way we could sort of categorize the different gaps or dysfunctions in global governance in 5 different categories. And I think most of the global governance dysfunctions that are relevant, they can be placed in one of these categories. One is the democratic deficit, for instance, when it comes to the financial institutions, where there are powerful nations that have the final say usually. We have weak accountability mechanisms. The Bhopal tragedy illustrates one of them, how to have a judiciary system that really can handle the risks that we see during the operation of transnational companies. We have institutional stickiness. One very clear example is how trade agreements are difficult to change, even though we know that some of the trade agreements they negatively impact health. We have absent or nascent institutions to protect health. One very clear example is the volatility in food prices. Speculations in food commodity markets very often give rise to tremendous price hikes that the poor population put the poor population in a very difficult situation. We need institutions to ensure that such speculations and the volatility that ensues do not affect the most vulnerable populations on our earth. And there is a lack of policy space for health. Very typically, what we see as a side effect of the austerity measures taken in many countries in the world is that there is a lack or a reduced policy space for health, as we see, for instance, in Greece today. And also, on a more general tone, the health and well-being is often subordinated under other societal objectives like economic growth. That is quite obvious. So the agenda for change that we propose in this particular report is that on a more general level, there should be a stronger cross-sectoral global action for health. And we hope that the report will play into the discussion as to how to develop the Sustainable Development Goals post-2015. One of the more concrete measures and proposals that we take is to establish a multi-stakeholder platform on governance for health, where we provide political space for diverse stakeholders to frame issues, as it's said here, set agendas, and debate policies, also policies in the making that impact on health and health equity. And another concrete suggestion will be that we establish an independent scientific monitoring panel, trying to get academics from all different disciplines to simply monitor the development in the global governance system to ensure that we pick up those dysfunctions that impact negatively on health. And a rhetoric question is, of course, if we have an independent scientific panel on climate and biodiversity, why not have the same thing for the political determinants of health and sustainable well-being? So the interesting thing, and this is what we hoped for, is that the report from this commission will serve as part of a platform for the future education in our university when it comes to global health. We are moving towards a blueprint for future education. And these 3 points will figure prominently in this new platform, that health equity should be a cross-sectoral political concern, that we realize that many health determinants are beyond the capacity or outside the control of national governments, and that global governance obviously must be rooted in a global economic system that serves a global population of healthy people in sustainable societies. What are we doing now in more concrete terms to create those change agents that we need? One of the measures that we have taken is to funnel all new students now through a series of lectures called Global Citizen Lectures, where the new students in all disciplines are encouraged to reflect upon the global challenges that we see today, also, of course, the health challenges. And we are now in the process of establishing a new program, educational program, which we call the Oslo School of Global Governance. Global Citizens, why? Why a Global Citizen lecture series? One of the very good quotes that we have on this is from Ghulam Mohammed Debai, former Secretary General, Association of African Universities. He says, and I think this is something that we can agree to, that now there is a need to address some of the major global challenges in the educational system and help achieve global sustainable development. And it's quite clear that these lectures appeal to the students. The first lecture that was given a couple of years ago, it was given by Professor Hans Rosling. There was a queue spanning 400 meters on the university campus. All the students wanted to take part in this lecture series. And you can see Hans Rosling to the right with rolls of toilet paper trying to demonstrate demographic development in the world at large. So this is something that the students were very appreciative of. And when it comes to the Oslo School of Global Governance, which is upcoming, we want to merge different disciplines, social sciences, law, medicine, and so forth. And the central topics, of course, will be health, democracy, and human rights. The final slide. We will not be able to do this alone for obvious reasons, and I do hope that this forum and the subsequent fora could be a means by which we can establish a good collaboration with other institutions in this very important field. And since Richard Horton is here, I have to give you the contact details for the Commission, and I also have to tell you that the report has still to be accepted by Lancet. But hopefully it will be accepted in the final round. Thank you for your attention.
Thank you, President Otterson, and congratulations to you and the Lancet for taking on this problem. I think we often think that health happens, and we know that it doesn't without oversight and without investment. So the last speaker is Fred Bink, and I'm delighted to introduce him to you. He's a friend and a colleague. He's an internationally renowned expert in malaria and in clinical trials for malaria. He's served on many WHO advisory committees and as well as for NGOs. He's the first recipient of the Rudolph Geige Award in 2001. He graduated from the University of Ghana, where he received his doctorate of medicine, and then obtained an MPH with distinction from Hebrew University in Israel, and then a PhD summa cum laude at the University of Basel. So he's really had a global education. He is now the inaugural Vice Chancellor of a new university, the University of Health and Allied Sciences. And he's going to talk to us about the World Federation of Academic Institutions for Global Health. Please join me in welcoming Fred.
Thank you very much, Dean Clark, for those very kind words. Good afternoon, ladies and gentlemen. I'm not going to use the PowerPoint. I'm here to speak on behalf of our colleagues in several networks across the world that are coming together to form a federation of academic institutions in global health. As we all know, the health of populations continue to be part of human development. So also has been the introduction of public health interventions, which have been critical to human survival and development. We've seen changes in the dominant public health issues as time and human development progress over the ages. From the simple challenge of poor sanitation to now the complex lifestyle diseases, from infectious diseases to non-communicable diseases. And we've seen location and geography have been closely linked to human development. We've also seen the emergence of diseases in the low and middle income countries that are completely different from those of more advanced and developed countries. We've documented different disease conditions that have affected populations in the tropics and the subtropics, and we also have documented disease conditions which have presented in very localized areas in countries or regions of the world, while other disease conditions have spread across political boundaries and affected populations across the globe. Training of public health professionals has equally progressed along these lines over the years. We have training in institutions, and we progressed to national training, to regional training, and now it's becoming a globalized phenomenon. We just heard about the MOOCs and its impact that it's going to have on public health training. The earliest records I've seen show that the first diploma in public health was actually run by the University of Cambridge in 1875. Since then, most of the programs of recent times have been graduate programs. You have the Masters in Public Health, Masters in Global Health, and we also had diploma courses, and currently, in the recent development, we are having undergraduate training programs. I think John Hopkins is leading this charge now. And it's obvious that some of these are happening both in the US, in Asia, and parts of Africa. In Africa, we've had slow development of the programs at national, regional, and continental levels. But university programs in public health started actually in schools of medicine and have progressed to schools of public health, and now we have few schools of global health. The field of public health itself has developed over the time, and we will call it a field rather than a discipline because it encompasses several disciplines: epidemiology, the social sciences, demography, law, economics, and so on. And this has benefited from being under universities. However, I think the coming together of these universities has also played a major part in defining some of the core areas or core competencies that people who are trained in public health are taught in the schools. So you've had the advancement of this field has been greatly influenced by the universities and now by the networks that have come together in most of the regions. We have networks of schools of public health and global health across the world. I think the oldest is the Association of Schools of Public Health in the United States, which was established in 1943 and currently has transformed into the Association of Programs in Public Health. And at the moment, I think every region seems to have an association that brings together these schools of public health. So the second one in Europe, we have the Association of Schools of Public Health in the European region. In the Asia-Pacific region, we have the Asia-Pacific Academic Consortium for Public Health. We also have the Network of Schools and Programs for Public Health in Canada, and we have the Latin American Associations of Schools of Global Health. And finally, in Africa, we also have the Associations of Schools of Public Health, which we started in 2010. I think these regional associations have been working together over the last decade or so. And it's through their efforts and their recognition that there was a need to work together more closely and to create a voice to be able to influence education and training of the next batch of public health professionals. So I have just mentioned the schools. I'm not going to talk too much about who they are, but we can discuss that later. The schools started developing what they call Global Summit of Schools of Public Health. And the first Global Summit was held in Taipei, Taiwan, in 2009. At that time, there were 3 regional bodies that met. The American regional body, the European body, and then the Asia-Pacific body met in Taiwan, and they agreed to work together. This has resulted in 3 other summits, one in Amsterdam in 2010, and the third in Washington, D.C. in 2011, and finally, the 4th in Accra, Ghana in December of 2012. At these meetings, these regional groupings decided that there was a need to work with other academic institutions to create a common platform where we could discuss issues on the future training and education of public health professionals. So the mandate was given to us in Ghana to work with other colleagues to agree to try and establish a platform to create this federation. And that's why I'm here today. However, it's not only the fact that we want to work together. This is important. But we also recognize the need to bring on board several regional bodies that coordinate academic institutions with interest in public health. We think the Federation will provide a forum for exchange of ideas on topical issues that will advance the public health field. Some of the regional institutions that we think will work with us on this already have been identified. For example, we have the IGA, which is the body that coordinates academic institutions in global health within Europe. We have the Consortium of Universities of Global Health, the CUGH. We have TROP-ED. Some of the students are here. We have also the Federal Society, the Federal European Societies for Tropical Medicine and International Health, and many more that I have not identified. And the idea is that we should bring all these people together and all these networks together to create a platform. We also need to take serious notice of developments on the global stage in this area. First, the United Nations Millennium Development Goals, which are about to have a sunset in 2015, but will be replaced by the Sustainable Development Goals that are being discussed. These international initiatives do affect how we train the next set of public health professionals. How do the public health practitioners interact with the wider non-health sector through intersectoral collaboration, and how does this impact on the goals that we are setting for ourselves? We also identify the recent developments in education, and Antoine just told us a lot more about that now on the MOOCs, the massive open line online courses. These have implications for public health training for the future. We also are taking notice of the fact that there are global agendas to eradicate some of the infectious diseases. Polio is one. We have some success with smallpox, but there are actual agendas for malaria and other infectious diseases. We need to look at the new agendas on non-communicable diseases in the low and middle income countries, which is becoming an epidemic. We need to look at issues related to climate change and the ramifications on health and the threats that this will have on our global village. We also need to look at the global pandemics that have affected us in recent times, and that this all will have an impact on our education and training programs and research within our schools. In fact, the graduates of our schools are being organized under the World Federation of Public Health Associations, which is an international non-governmental organization composed of 32 national public health associations, but this represents the non-academic areas of the public health practice. And it just makes sense that we should take note of that. And as institutions that train public health practitioners, we need to create a platform to get our act together, to be able to provide the necessary guidance, the necessary public health or global workforce that will make the dreams of the world in these initiatives come to a reality. I think the time is now. It's time to strengthen the training of the next generation of public health professionals in global and public health, and to develop the appropriate competencies through research to address the old public health problems, but also to prepare adequately for the global world in which we live. We need to confront these challenges that have transcended political and physical boundaries in the global village. And I think this is the time for all of us to work together to create that platform that will allow us to exchange ideas. So for me, it's a singular honor to propose for the establishment of this federation. And what we expect this federation to do is to have a mission. The federation's mission is to give a global platform for an academic voice to influence policies on health and global governance mechanisms, to promote methodological development and research, and to share good practices in capacity building on educational innovations. This will be achieved through a couple of objectives, which include to build a global community of health academic institutions that promotes and implements transnational and inter-regional collaborations in global health research and education, and enhances their role in the post-2015 Sustainable Development Agenda. We also need to develop equitable partnerships to advance training, education, and research in global health, and developing and disseminating good practices generated through such partnerships. To support the efforts to achieve universal health coverage through education, research, and development of evidence-informed policies, to forge collaboration between health and other disciplines and sectors such as veterinary medicine, agricultural sciences, ecology and environmental sciences, water and sanitation, architecture, and urban planning, with the intention of promoting integration of health into research and policies of these sectors. Finally, to generate better research evidence on the health implications of policies relating to international cooperation and governance, world trade, global environmental changes, food security, and to promote the integration of evidence-based health priorities and concerns into these policies. In conclusion, the world counts on a number of regional bodies that coordinate academic institutions with interests in public and global health, as well as coordinating bodies for the national societies of tropical medicine and international health. However, there is currently no global representative body in which these institutions would work together to provide evidence to inform policies on global health. Education, including the development of curricula, of the new generation of global health workforce that we desire to meet the new challenges. We hope that this platform will provide us with the possibility of making these discussions and contributing very much to integrating health into the Sustainable Development Goals of the post-2015 agenda. It is my singular honor to make the case for the formation of the World Federation of Academic Institutions in Global Health. Thank you.
Thank you, Fred. So I think many of the themes that you sounded fit nicely with the speakers who went before you. So we have about 30 minutes for questions. I'll ask people to use the microphones and here in the middle aisle. Let me just start then and take the speaker and ask Antoine Flahaut. So Antoine, the impressive, I love the idea of a MOOC platform in French and German. We, as you know, have been engaged in MOOCs, and for the 8 courses that we've taught, we have had over 500,000 students. Now, I get considerable pushback from my fellow deans, not in schools of public health, but other schools who think it's crazy to do MOOCs because it undercuts the university. And I'd like, and you're going to be asked that now, since you've engaged in MOOCs. Could you tell us what your thoughts are about that?
Yes, first of all, I think you have much deeper experience in MOOCs than I have and than we have in Europe. In fact, I am interested in particular fields where the university are not going in. For instance, the training of caregivers. You know, I think in the United States, 14% of the population aged between 40 and 65 are caregivers of people 80 and plus. In France, 4 million of caregivers. We have 4 million of caregivers. That means that these people are secluded sometimes, are of various backgrounds, are not well trained, need to be trained, have no money for that, and MOOCs probably are very dedicated to them. I don't think this kind of example may jeopardize the university model or may threaten the university model.
So skill-based training.
Yeah.
Comments from the audience? Well, I can keep going because I really enjoyed the talk, so I'm going to keep talking unless somebody gets to the microphone. So let me ask Fred then. You know, Fred, a wonderful vision. As I look at the field of global health, it's a very broad field, defined differently by many people, and there are many organizations that purport to represent global health. And I think one of the issues with global health is the lack of an accepted definition, but the fragmentation of advocacy. Do you think your organization will add to that fragmentation, or will it help?
Yeah, that's a very important question. At the last count, I think I have about 71 definitions of global health. So it's really a challenge. And we already identified this already, and we hope to tackle this on this platform, that we could bring all the groups together as much as possible and stimulate a debate on this. This will be one of our first points of departure, to try to make sure that we can have a point on what we think global health actually is. And we will be fortunate because we will have both the proponents of public health, global health, and the various ramifications of public health to have a good discussion. And then we come up with our viewpoint. But I think at the end of the day, this is one of the positives for having this platform, so that we are not fragmented. We could agree to disagree, but we have a place where we can discuss and come to some level of agreement.
Okay, so I'm going to ask President Pedersen then. So a great vision that you presented, and you made the important point that decisions are often made not based on health, but on economics. Now, I think if we had an economist here who had worked in global warming, they would say the solution is to monetize health, right? The solution is to monetize the problem so it becomes part of the economy. And I'm wondering whether the Commission has thought about that, about how to monetize health so that money is what matters to people. So that might be a solution.
Yes, of course, this has been one issue of discussion, but before that, one has to come up with some quantitative measures to really measure the negative impact on health. And until this has been done, or until there is a system for doing this, I don't think we can proceed along that particular route. But eventually, it's a very good idea. But I'm not an economist, so I think that other people have to pursue this particular idea.
Well, health in all policies might be one way to do that. So we have a questioner, Richard Horton.
Richard Horton from The Lancet. Wonderful talks, but I wonder if you're all living in fantasy land. And the reason why I say that is that, at least in the United Kingdom, but I don't think this is confined to the United Kingdom, we've seen higher education and research institutions colonized by a corporate culture which has distorted the traditional values of higher education and independent research into something quite different. We've seen the marketization of higher education. We've seen outsourcing of services, an introduction of a corporate governance that more mirrors the business community. We've seen the commodification of research and higher education. So all these wonderful values that you're talking about are great in PowerPoint slides, but in the reality of daily life in our leading higher education institutions today, we see something very, very different. We see the erosion of the values that have driven the Enlightenment for the past 300 years. And we're at a crisis point where those values are in real jeopardy. So what are you doing to protect those values?
Well, that's a very good point, Richard, but I do hope you're not living in fantasy land. In my own country, what we really do now is to look onto what is happening in other countries, including your own, as to the erosion of the values that you referred to. And I must say that perhaps Britain is now not really the best example as to how these values can be maintained and respected. So in our own country, I would say that the outlook is not as bleak as your statement would have it to be. And next year, for instance, our university has decided that the core priority will simply be to debate those very issues that underlie the university and its mission. So we are doing what we can to uphold these values that you refer to, because without these values at the bottom of our activities, then this will be a fantasy land, I agree.
So I would ask my other colleagues from Europe to comment, because we've already lost the battle in the US, so it's no sense.
No, first of all, I think that without fantasy and without dream, we cannot expect to maintain these values. So, in fact, we absolutely need these dreams, and we absolutely need to continue to dream and continue to demand these values of the public service you are mentioning. But also, we could have said that the spirit of Europe was a fantasy or was a dream 50 years ago or 60 years ago when it was created. When in fact, I think, for instance, we have some strong commitment in Europe regarding the protection of data. And it is often seen by the best clinicians, the best doctors in hospitals as constraints for their research progress and so on. But we can see now, and particularly with the tremendous problems with the big data which arose in the US, particularly with the NSA, that it is our protection. So what we thought were constraints in our daily life become today some kind of protections of our citizens. So I think if we continue to believe and to fight for these protections, we will be aligned with probably what you are calling.
Yeah, I think from where I sit, I don't see this as a fantasy at all. In fact, we haven't started yet. We'll still trying to pursue these ideals and these values in isolation. And the world is moving on. We are having, if you take the African continent, for example, we've been trying to have political coherence or some kind of a union or driving the political and economic agenda. But education has not actually started at all to move, to learn from what is happening next door. So for us, I think we are just beginning, and I think these kinds of groupings should help us to look into what we are doing and see how, with just a little bit of modification, we can uphold some of those values. We hope that we will keep in mind the problems that have befallen our advanced countries in America and others, and hope that we will not go that far. But we need to come together to be able to improve on those values and to make sure that those values are shared across most of the countries on our continent.
So front microphone first, please. Yeah, louder.
Yeah, that's the button. Okay. My main concern with MOOCs are two. One is the bandwidth. You mentioned that, and we have even problems to have a Skype meeting with our partners sometimes. How can we do fancy video streaming and so forth? So this is for me Fantasyland in terms of technology. Where are we, and are there new breakthroughs that we expect to have, let's say, with Ghana or with Burkina Faso or Cambodia, to have this kind of, so are we not leaving out those who need it most? The digital divide, as you know, is the jargon for this one. The second point is concerning the commercialization or commodification of internet-based training that Richard referred to. I thought, maybe I'm naive, the internet was a possibility to do things without corporate funding, to have, why is it so expensive to have an online course? Maybe I am exposing my naivete here, but I want to know why you need corporate assistance to get an online course in public health online. Everybody laughs?
No. I think no. Thank you,
Okay,
Renat, for this question. I think I can answer. I think it is two very important questions. The first one is technical regarding the bandwidth, and it's completely true that today there is not appropriate bandwidth in many areas of sub-Saharan Africa. We can say that. So I think we still need to rely on both models which are, there are some way for lightening the without any video signal, for instance, just the audio one, and with some non-completely real-time, but there's some way for overcoming this issue. Regarding the second one, first of all, I don't think that the private-public partnerships are per se the evil. I think we can have some good private-public partnership in transparency first, and so it's not because of a need of funding that we may accept to work with private companies. So we have to think, we have to judge what is the potential conflicts of interest, the potential influence in many actions. I completely agree with that, but I don't think we have to build two separate worlds, one which is only public and one which is, it's probably not your proposal, but I just wanted to say that. The second point is, and the last point is, I'm not sure that MOOCs are only heavy, costly pedagogy. I think we have various forms of MOOCs, but if you address to an audience which is very broad, a lay public, for instance, like the caregivers I was mentioning, they are very demanding or expecting in terms of quality because they are not use to the quality we may be found much more acceptable for students, for instance, or for doctoral students, or for some kinds of professionals which are very homogeneous, much more interested in the content and not so relying on the quality of the video, for instance. So I think we may have some various, the cursor maybe at various positions regarding the type of MOOCs we are building. But maybe Mike has some other opinion on that.
I think, so I do live in a fantasy world. At our school, we have our curriculum on the web for free. Anybody can download it, and we've had millions of downloads. Through the Open Courseware Initiative at MIT, we participate in that. And so anyone can use our curriculum to teach. As long as they don't sell it, they can use it, and lots of people do. We have an online MPH, which I think we've had a student from every country in the world. And you're right, you can't do video in a low bandwidth situation, but I think it's attractive and it engages people. What I worry about with the MOOCs is that the business model is just not clear. How this, right now it's being sustained by people putting money in because they think there will be a way to make it economically viable in the future, but we don't know if that's the case. And then, so we could build up a large, if you will, user base and then not be able to sustain it. So back microphone, please.
Thank you. I'm Kenji Shibuya from the University of Tokyo, Japan. Following up something what Richard asked. Recently, our Prime Minister was on the front page of one of the British medical journals, although I forgot his name, Richard. And he put an emphasis on universal health coverage as Japan's core global health strategy. And Japan has been promoting human security as opposed to national security as a fundamental core diplomatic principle. So the extension of human security is natural, universal health coverage. But here comes the problem. So all the Minister of Foreign Affairs officials come to my office, what to do? And universal health coverage now become a global agenda, but actually implementing it on the ground is a domestic issue, local phenomenon. And it requires political context and a historical perspective. It's not that easy. This is another example of a growing tension between national sovereignty and the imperative of global collective action, as you just mentioned. The example includes intellectual property rights, PM 2.5 in China, or Syria health crisis. So there are many issues which we need to tackle. So I see actually a big black hole of leadership in global health governance right now, as opposed to your suggested direction to develop these competencies. So I'd like to ask you, how are you going to develop that kind of competency, not just institutional, but also competency, the capacity to tackle these challenges which tend to be local from the global perspective? Thank you.
So maybe stay at the microphone one moment, and we can see who wants to tackle your question, and maybe it's directed towards Richard Horton. But the issue is, how do we develop these competencies when we have to decide between local imperatives and global imperatives? So I would ask President Otterson, did that come up in the commission? Are there plans in the master's degree that you're offering to deal with that trade-off?
Well, certainly, I think it was even on my slide how to analyze the interaction between the different levels of governance, including the national, supranational levels, but also the regional levels. I think that this is an issue that students have to be exposed to. And whether there are any quick fixes as to how to make priorities, well, I'm not the right one to ask. I think this is one of the perhaps most important and difficult issues to tackle in the time to come. So I don't think I can go further into details on this.
So one thing I would say from my experience with running a school of public health is that advocacy is not an academic subject, right? We don't explicitly train our students in advocacy. Now, it turns out that most students who go into public health, you don't have to. You have to hold them back. But that is, to me, that's a key feature of what you're talking about is how do you educate folks about the importance of global as well as local, because they understand the local situation. And then how do we have them take evidence, which they're good at generating, and become advocates for it? And in academic systems, that's generally not rewarded. But that's how we make change. So any other questions or comments? The back microphone, please.
Thank you. Deborah Olson from University of Minnesota. And if this is living in a dream world, I want to thank you for that world. Because as each of you have provided your vision of innovations, whether it's from MOOCs to new federations to being global citizens, my question is, and Mike, you just alluded to it, how do we as administrators at universities reward innovation of these types with our faculty and our university structures?
Or despite the university structures.
Or despite the
You want to? Thank you for this question, because it is around the economic model of the MOOC, at least for the MOOC part of what you are saying. To tell you, I have a proposal which could reward the university, which is a small fee per course. I think that if we are in a transparent world, if we don't sell the students' data, we will need to find some funds to be sustainable. At the early beginning in Europe, we may have and we may got some European funds, some governmental funds. It's possible from some partners, from private partners also. But if we want to be sustainable and not depend on any source of funding, we at least need to have a model which is because of a kind of crowdfunding, if you see, because of the massive amounts of students we may expect, we may imagine to have a small, very small fees, which will be rewarding for the universities and for the platform because of the cost of the maintenance. So this is the kind of model I would like to implement, but we need first to have the experience of this platform. And you know, many things are working like that on the internet with premium. The beginning is for free, but if you want to be certified, that is like that on Coursera already. You have to pay a small fee. So maybe this kind of model will be something which we go toward.
But I think this is a real major problem in trying to reward the people themselves directly, because as universities, we tend to reward people for their academic accomplishments and so on. So this is really a challenge. But I think that there are ways in which this whole new area of knowledge could also become an area where people could research into and develop further innovations that could reward them. But truly, it's a challenge that needs to be looked at very carefully.
Well, I think it's a very good question. I think this is where Richard Horton's concerns come in, because in many countries now, as you know, impact is the keyword. Unless you can prove that you have an impact during your research and activities, then you're lost. And but the interesting thing there is that in most definitions of impact, the regional level, the national level are very much in evidence, but not the global level. So this will be a tremendous setback for the academic activities towards the more global challenges that we're facing if the impact term is allowed to take over the governance of the university. So in this respect, I think Richard Horton is very, his point is very, very good and scary, I would say.
Yeah, I would say at our school, we're fortunate in that the promotion decisions and the adjudication is made at the school level, not at the university level. It goes to the provost for approval. And so often you have problems explaining the work. And I remember a dean at another school who said to me that he would have a distinguished faculty member he would put up for promotion, and it would come back and they would say, well, I know he saves millions of lives, but is it really science? Yeah, and so we don't have that issue, but I would say for the MOOCs and for advocacy, our faculty who are best at advocates, the ones who are passionate about teaching the MOOCs, are the ones who publish the most. And so we haven't had to deal with that. But at our school, someone who taught only and was great at MOOCs but didn't publish, they would seen as not be having an impact. So scholarship is important, but yeah. So I see a hand in the back. Oh yeah, you were up before, sir. So maybe front mic, and then we'll go to the back and end.
My name is Joshko. I'm the current president of the International Federation of Medical Students. I just wanted to ask you, we talked about the importance of health in all policies, global governance for health, and there are suggested solutions such as, to read them, independent scientific monitoring panel, multi-stakeholder platform governance for health, education for students, and global citizenship. But do you find it important to channel these ideas into public health messages so that they reach a wider audience, so that they are supported by the general public? Because last year we had an example of Mayor Bloomberg in New York trying to cut down the sizes of soft drinks, Coca-Cola, and he faced a fierce anti-campaign because it has been a common practice to turn health issues into a fundamental debate about individual freedom and choices. So I would like you to comment on that if possible. Thank you.
Yeah, it's interesting that you mention this particular case. On my way here, I came across a piece in the Financial Times about taxation of sugary drinks, sodas in Mexico, where there is a tremendous debate now going on. And in Denmark, they have tried this without, and I think they had to retreat from having this tax in Denmark. So obviously this is an issue that is contentious and difficult. To your specific question, obviously in commissions like this, we haven't invested so much work in this commission without having a plan as to how the research should be disseminated and how we should try to ensure that some of the conclusions are translated into practical politics. This is a major work ahead. So we will certainly try to reach decision makers at all different levels, to put pressure on governments where need be, and also to see if one can create a better awareness about all these dysfunctions that we now see in the global governance system outside of the health sector.
Thank you. So there was one last question in the back, please. In the back. We have time just for one.
Yeah, thank you.
For the back microphone.
Hello. Is it on? Hi, my name is Waruguru. I'm actually a youth commissioner. My question is about youth and youth participation in this whole discussion of education. As a youth commissioner, I've had the great pleasure and privilege of youth ideas being very considered and actually being taken into consideration as the commission has done its work, and also working with people away from the health sector as a medical student. So my question is to the academic institutions. One, is there efforts to increase public health, broader public health education at a younger level, so at an undergraduate level, both to health and non-health undergraduates, to increase the scope of how people view public health and their interest in public health? And the second question is, if there have been efforts to include health and non-health people to work together also at an undergraduate level. So are there health practitioners and health students being allowed to speak to economists and to politicians and to political scientists so that the education can lead to health in all policies? Thank you.
I think we'd say yes, 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 right? So at least in the U.S., those efforts are going on, and they're going on through the Association of Schools of Public Health and Programs in Public Health, and they're going on at the governmental level as well. I don't know if others would.
Yeah, we've started undergraduate programs in Africa now, but we have a big challenge. There are challenges in the universities accepting this. In fact, some of my colleagues will say they will not accept that. But we have a program that does, like in Johns Hopkins, an undergraduate program, and that benefits from the other faculties, because then we have the opportunity to enrich this whole training. But I think it's just started and it will catch up.
So, okay, go ahead.
Hi, my name's Flora. I'm a student from the UK. My question really is much more on a practical level. A lot of the conversation we've had today has been about education. And one of the problems I've faced personally as a student is how to transfer the knowledge that I've accumulated through education and have practical work experience. And I think there's a big link that's missing at the moment between academic institutions and public health institutions, and the opportunities that are given to students at the moment is rather elitist and Euro and US centric. So how are you addressing these issues of gaining the knowledge and actually getting experience so you can learn leadership skills and actually apply the knowledge that you've gained? Thank you.
So from the U.S. model, a practicum experience is required for all students now in Masters of Public Health programs, and it's for that very reason.
If I can just add also, according to the European model at the Agency for Accrediting the Public Health Education, we are focused on competencies. Exactly as in the US. The model is acquisition of competencies and not only of knowledge. So we are really focused to, of course, to build an education. So it's not, the competencies are not only pragmatical or professional oriented, but mainly, so an MPH, a Master of Public Health, is really a professional degree to acquire some competencies for a job.
And I think in Africa, most of the schools do offer many opportunities for people to have practical training. What is missing is there's now a move to link up with some of our colleagues in the developed world to try and twin this approach so that people can have a chance to experience some of these practical issues, whether they are training in Europe or in America.
So I see Detlev Ganten, our president, at the microphones. So we'll let you have the last word.
I'm a student from Berlin. And I understand students always get a chance to speak. And if you want to stay healthy, of course, you have to relax also. And there is a tradition, the World Health Summit night. Tonight at 7 p.m., in City Hall, which we call the Rote Rathaus, which is not the communist Rathaus, but it's very close here, and as you know, it's East Berlin. They're waiting for us, and the mayor will be there, and you're all cordially invited. It's right after the sessions, 7 o'clock, so just walk over there, and you're welcome. And tickets are available. There are a limited number of tickets. So go there to the registration desk and try to get your tickets. Thank you.
Thank you. Well, thank you for participating. It was a great session. I want to thank our speakers.